Well, many of the signs of kidney disease aren't in the kidneys themselves, but we better start by reminding where those are. So the liver's slightly small here. These are reasonably realistically sized kidneys, left slightly higher than the right, but they're misleadingly far back, so quite hard to find. If you take a cross-section of the body, where that dotted line is shown there, this is what you see. Here's the right kidney and the left kidney, very far back from the front, and from the back, hidden behind quite a lot of muscle and fat and tissue. So the books and the videos show the kidneys being examined like this. On the right side, you have to feel really quite deep to get down to the kidney, and if it's going to be palpable at all, sometimes you may have to help by lifting it forward from behind like that. And on the left-hand side, if you're examining from the right, you have to do a sort of backhand style of the same examination technique. Not easy, and kidneys aren't easy to feel at all if they're normal sized. You can just about feel the bottom end of the right kidney in healthy people. Similarly, if there's going to be tenderness, those are the places you would expect to find it, although it has to get right through all of that muscle for you to be able to feel it from the back. Physical signs of kidney disease, therefore, mostly aren't related to the kidneys, although there are some conditions when the kidneys are very big. They're related to edema, and this is particularly useful if you look from behind in someone who's been in bed for a long time. But while you're there, you may also see skin signs that the spinal cord hasn't been completely normally formed, typically a little anomaly, a hairy patch there, and some kinds of vasculitic rash characteristically affect the buttocks. You may find signs of cardiovascular system abnormalities, and of course you may find the bladder rising out of the pelvis like that. But nowadays, the signs that the textbook describe of chronic renal failure are more likely to be encountered in dialysis or transplant patients than in patients with long-term renal disease out in the community. And to be honest, these changes are quite hard to pick up. There is undoubtedly some pigmentation, sallow, yellowish pigmentation associated with chronic renal impairment at very low levels of GFR or on dialysis. There's also easy bruising, and the nail changes, although the textbooks describe them, they're generally quite unusual. The physical signs you're perhaps most likely to encounter nowadays are the signs that a patient has been on dialysis or transplanted. And if you find a transplanted kidney, it won't be in the usual location. It'll be down here under what looks like an extremely enlarged appendix scar on the right or left. And if it's been in there for a long time, it may actually be very hard to feel anything that feels kidney-shaped, but that's where it'll be. And you may also see the scars, signs, and occasionally devices that are in there for patients' vascular access procedures so that they can be connected to high flow rate machines. These will be either central venous catheters in the neck, and you may see the scars of tunneled lines, or they'll be the fistulas in the periphery, in the arms, and occasionally legs, used to needle for dialysis, or the scars from where they used to be.